I would
Yes.
rather an alive child with
Yes.
bruises and
Yes.
broken bones than a
Then
child that
yeah.
dies because of choking.
Every year, children choke on things parents never expect. In this video, you will learn the simple steps that could help save a child's life. So, hello guys, welcome back to my YouTube channel. My name is Ruth, and this is Raising Kids in Real Time Unfiltered. Today, we're joined by a pediatric emergency expert who will show every parent what they need to know and how to stay calm and act fast when a child is choking. So, hello, Esther. Thank you for joining us.
Hello.
Could
Thank you
you
for
please?
having me.
Thank you. Could you please introduce yourself to us?
Sure. Good afternoon, or whenever everyone is watching this. My name is Esther. I am a pediatric nurse of over 10 years. So my specialty, or should I say my speciality, was once neonates, so very little babies. And then I moved into public health. And currently I work in public health now. So I do a lot of behind the scenes, but yeah, I've been doing that for a couple of years. So, but yeah, I'm really excited to share and yeah, have this discussion, this very, very important discussion. So,
Yes,
yes.
yes. Thank you so much, Esther. Thank you for agreeing to come join us today.
A pleasure.
Thank you. Thank you. All right. So, the thing is, Esther, parents often hear the term ABC
hmm
in emergencies. So, what does that actually stand for?
Okay, so ABC is a terminology that is coined within health, and what it looks at, it talks about the different areas and facets of anybody. So if you're learning about how to respond in an emergency scenario, you will hear something called ABC. So your A represents your airways, your B represents your breathing, and your C represents your circulation. There's also other areas like D for disability, E for exposure, but that's when it gets a bit more complex. But ABC focuses on your airway, your breathing, and your circulation. And in an ABC, when you hear about ABC, what a professional, or even it doesn't even have to be a professional, it can be any person in an emergency situation. What they are doing is they are assessing you from head to toe, as you would do ABC. First is your airways. In
Yeah.
an emergency situation, you want to assess that the airways is open.
Yeah.
Us talking now, our airways are open, so there isn't an emergency. B, you're looking at your breathing. So as we're talking now, whether we're sitting down, our chest can rise up and down. When you are not breathing, you don't see that. Likewise, you won't be able to feel a pulse.
Yeah.
And C looks at your pulse and also signs of like good blood flow. Is there a heart rate? Is there a rhythm? That's in essence the ABC of
Okay.
emergency. But
Yeah.
also that's not just for nurses, doctors, that's for anybody at all. Yeah.
Okay. Okay. Thank you so much, Esther. Thank you. So I was gonna ask you, do you assess a child's ABC the moment they are born, or is there a time when the child needs to come into the hospital for you to assess it, or is it immediately after birth?
No, so when a child is born, your midwife will, so to answer your question, yes. Any
Okay.
health professional will be checking, is the airways clear, is the baby
Mm,
breathing, is the baby's heart rate, color, overall condition. It's an initial part of any assessment, whether you are 0 or 110. It's always
okay.
part of your assessment. Yeah, and you're continually assessing because
Mm,
scenarios can change, emergency situations can change. A child
mhm.
can get better or a child can get worse. So,
Yeah. Yeah. Hmm. That's fine. Thank you, Esther. Now, why is the ABC approach so important when assessing a child?
okay, that's a good question. So, in my experience and what I found with children and young people, generally, children can deteriorate very, very fast. So, you can see a child playing at 1 minute, then before you know it, they can be absolutely not responsive.
Mm.
So because of that, we realize that sometimes issues can escalate quite quickly. So,
Mm.
without, if a child's airway is blocked, they won't be able
Mm.
to breathe, right? And if
Yeah.
a child can't breathe, that means the brain is being starved of oxygen
Mm.
by the
True.
minute.
Yeah.
So by following the ABC, what we're doing in essence is we're prioritizing the most important thing, which is your airway and your breathing, to
Mm.
make sure the child is alive. So, and
Mm.
that way, the right treatment is given at the right time. So, yeah.
Mm. Okay. Thank you so much. Thank
All right.
you. Now, how can parents recognize a child's airway might be blocked?
Oh, good question. So if a child's airway is blocked, the child may be having difficulty in breathing.
Mm.
They may be struggling. You may hear something called stridor. You
Mm.
hear that during the winter, and
Mm.
sometimes when a child is struggling to breathe because of maybe they've got a blocked nose, they will
Mm.
normally be like
Yeah.
a sound like that.
Yeah.
Sometimes it can also be high pitched as well. You know,
Mm.
and then also, let's say the child cannot cry well. We all know that when a
Mhm.
child is crying, they are
Mhm.
very loud. If
Mm.
a
Mhm.
child is not crying loudly,
Mhm.
I have about 10 alarms that will be sounding to me.
Mhm.
So if a child cannot cry or they
Yeah.
cannot speak,
Yeah.
also other things such as if a child looks very floppy, their lips
Mm.
are blue, they become unresponsive. That's how a child's airways might be blocked, and it can be through things like eating. It might be they might be choking on something. It can be
Yeah.
anything. Yeah,
Mm. Okay.
yeah.
Thank you. Thank you, Esther. Now, talking about choking,
Hmm.
like I said previously, every year children choke on things that parents don't even expect them to choke on.
Yeah.
So, now what should a parent do immediately if a child is choking?
So first thing I would say, what a parent should do if a child is choking, it sounds silly, but you cannot panic. You cannot panic because that
Okay.
child already is also panicking. So
Yeah.
two panicked people causes
Mm.
pandemonium.
Mm.
So it's very important that you it is scary. I'm not going
It
to lie
is.
and say
Yes.
it's not a
Yeah.
scary thing, but you've got to be the adult in the
Yeah.
situation. First thing you need to do, you need to call 999.
Okay.
Definitely. You need to call 999, get them on the phone. Whilst 999 is cooking, you're almost cooking a bit of a meal here. 999
Mm.
is on the stove cooking. You go
Yeah.
back to your ingredients. In this instance, is your child. You need to
Mm.
make sure that you give 5 back blows
Mm.
between the shoulder and the bottom of the back. Now, it's not one of those, oh, I'm just tapping the baby. You
Mm-hmm.
almost have to hit that child as though
Mm.
you're breaking their back. And I have seen in my experience where
Yeah.
sometimes ribs are broken or bones are
I was
broken.
going to ask. Yeah, I
Yeah.
was actually
But
going
the
to ask.
child is alive. But the child is alive. I would
Yes.
rather an alive child with
Yeah.
bruises and
Yes.
broken bones than a
Then.
child that
Yeah.
dies because of choking. And it's something that we see regularly. If somebody may ask now, so Esther, what happens if the back blows don't work?
Mm.
For children that are under 1, you can give thrusts through their chest as well.
Yeah.
It's like the Heimlich maneuver.
Mm.
But should only do that for children that are over 1.
Okay.
Sometimes what people tend to do is they go between the back and the
Yeah.
Heimlich, so between. But I think it's also important to familiarize yourself with the Resuscitation Council in the
Mm.
UK that has all the
Okay.
information. And a
Okay.
lot of people, you may find it may not even be a child. You can be sitting in a restaurant and
Mm.
it can happen to somebody.
Someone else.
So
Yeah.
it's really important to familiarize yourself with it. But I
Mm.
know that if you're a parent and your child is choking, it's
Mm-hmm.
so important to make sure that you keep a cool and calm head. So that way you can make rational decisions
Yeah.
rather than you kind of fluttering. Yeah.
Mm. Oh,
But
thank you.
obviously, you're also waiting for by now, your 999 service would have come to your door.
Yeah.
So,
Yeah.
yeah.
Yeah. Wow. Thank you, Esther.
Yeah.
Now, aside from the panicking,
Mm,
yeah, you just mentioned parents
mm,
shouldn't panic. Yeah, aside from
mm.
panicking, what are the common mistakes parents make when responding to choking?
Ooh, okay. Aside from panicking,
Yeah,
putting their hand in the mouth to try and get the
let
object.
them to, oh
Because naturally, as a parent, that's the first thing you want to do, right? You
yeah,
want to
yes,
go in
yes,
there,
yeah, yeah,
you want to try and, but actually, in doing that, you may
mm-hmm.
dislodge the item even more, or you may
Mm-hmm.
push it down further. So it's important that unless you see it visibly, as in,
Mm-hmm.
you should
Yeah,
not be
sticking
putting your
out or
hand down.
something. Yeah.
Yeah, you should not be doing that.
Okay.
Um,
So if you see
something,
it sticking out,
yeah. If
or
you
if you
see
see,
it like just in the mouth, like
yeah,
maybe the side of the cheeks or the
okay,
tongue, then you can pick that out. But if
okay,
something is past the throat, the
yeah,
esophagus, you're not gonna get it out. It needs to be
yeah.
back thrusts. Another mistake I would say, mm, I see this one in a certain type of demographic
Mm-hmm.
where you turn the kid upside down or
Mm.
something because actually your fear your
Mm.
fear factor is to no,
Yeah.
that doesn't do anything. That just makes the kid more disoriented. It makes the kid disorientated. It makes you disorientated.
Of course, of course.
The kid is now confused whilst
Yeah.
choking.
Mm.
So do not flip your child upside down. Don't do that. Don't
Thank
do that.
you.
And then
Thank you for that.
also I think it's important to encourage the child to cough. Obviously
Okay.
if it's a baby
Mm.
cannot cough as well. But if it's a young child, you
Yeah.
should always try and encourage the child to cough because actually, what coughing lets me know is that you can still breathe, but you're just struggling to breathe, and
Mm.
you're trying to resolve it yourself.
Yes,
When a
Lord.
child is choking and there is no coughing, then by all means, you need to start thinking about back blows,
Okay.
as in
Yeah.
hitting them on the back,
Yeah.
or Heimlich maneuver. Yeah,
Mm.
yeah.
Mm. Oh, thank
And then
you.
obviously, in addition to panicking, so yeah.
Mm. Thank you, Esther. Thank you. Now, let's talk about the seizures.
Okay.
How should parents respond to high temperatures or febrile? Is it febrile or
So it's febrile, yeah,
Yeah. Thank you
febrile.
for I'm not
So
used to these medical terms.
no,
Yeah.
it's fine, it's
Feb-
fine. So,
Febrile seizures.
yeah, so a febrile seizure, for anyone that's not aware, is a
Mm.
body's response to an overly hot interior. That's what I would call it like.
Okay.
So imagine your oven, you've left it on for the whole day, and
Mm.
it's so hot it begins to shake.
Mm.
That's a
Mm.
febrile seizure. Yeah.
Okay.
So if a child has a febrile seizure, it's so important that you obviously call 999, especially if it's the child's first seizure. So this
Mm.
has never happened before.
Mm-hmm.
If it's never happened before, again, it's important to stay calm, call
Mm.
999. You also need to make sure you keep an eye on the time. If that seizure
Mm.
lasts longer than 5 minutes, then there's obviously cause for concern.
Mm-hmm.
Likewise, again, remember what I talked about the ABC. You
Yeah.
want to support that child's airways. You want to put them in a recovery
Yeah.
position.
Yeah.
If they're on the floor, you want to protect their head. You want to protect their
Yeah.
body. What I see people doing sometimes is they'll put their legs across to stop the child from shaking. You shouldn't do that because you can cause more harm to the child in that instance. Yeah.
Okay. Okay. Thank you,
Mm,
Esther. So, as a mom, I'm speaking from experience now.
mm,
Sometimes you see something in your child that you're not sure of or
mm,
sure about, and then you decide to call 999. They come over and they tell you, oh, the child is okay, there's nothing wrong. So
mm.
now, what situations may not look serious but actually are? Because some parents see
Ooh.
some things in a child, they're not
Mm,
sure, of whether taking them to the hospital or calling
mm.
999, and
Yeah.
then and then you find out that
Yeah, this is
serious.
something. Yeah.
Yeah.
That's a good question. I think I will always encourage parents, you know your child better than anybody. You know,
Mm.
the doctor can tell you no, but you as the parent, you know your child,
Yeah.
you know. And even with parents that have two children, no two child
Mhm.
is the same. Twins are not the same, triplets are not the same. So
Mhm.
you know if there's an issue. I mean, it's twofold. Nothing
Mm.
stops you from going back to your GP or to your emergency. You may have to
Mm.
wait, but nothing stops you. But I
Okay.
think that some conditions that people tend to maybe overlook sometimes, it can be when a child is breathing faster than normal. So, or if their breathing is labored. What do I mean
Mm.
by labored? If a child's breathing as though they've worked a 12-hour shift,
Yes.
they're
Yes.
struggling to catch their breath.
Yeah.
Sometimes you'll see something called tracheal tug. So this area of our chest, this part will go
Mm.
in if a child is
Mm-hmm.
struggling or has
Mm.
labored breathing.
Mm.
If a child is vomiting consistently, they're not able to keep food down. That
Mm-hmm.
is a big problem for me.
Mm.
Also, even if they're vomiting and then they're still vomiting more, that is
Mm.
a concern for me as well.
Okay.
Um, I would also say for the younger children, for babies, if a child is not having wet nappies, that could be a
Okay.
sign of dehydration as well. Because
Oh,
think of us as adults. When we drink, we
we
urinate, right? And when
yes.
we eat, we open our bowels.
Yeah.
If a child is not opening their bowels regularly or they're not urinating regularly, something tells me there's might be something going on there. Likewise,
Mm.
if a child is difficult to wake up, the child feels
Okay.
floppy, the child
Okay.
feels, especially if you know that your child is quite active, quite
Yeah.
playful, their personality, but maybe they're just very subdued
Mm.
or very sleepy, then
Mm-hmm.
100% I would be going back
Mm.
to your GP or to
Doctor.
even urgent
Okay.
care. Yeah.
Mm. Okay. Thank you, Esther. Thank
Yeah.
you. Now I'm going to ask you a question about bumps and knocks.
Mm,
Sometimes our kids go to school and then they
yes,
come back with the swollen head. And then the school tells you, oh, she
it's
bumped her
fine.
head on this, but he's fine. She's fine. And then you just see that little thing still growing on their forehead.
Yeah.
And as a parent, what I was told growing up was that
Mm,
if you find a bump on your child's head, just use
yeah.
your hand, press it down, press it, press it,
Oh no, what I've heard is
massage
you use
it.
hot water.
Yeah, or use hot water,
You use hot
just,
water.
yeah, use hot balm and just. So, what should parent do
Hmm.
when a child has bump on their head?
Okay. If a
Like
child has
what
a
we
bump
call
on their
head
head,
bumps, head
a head
bumps.
bump,
Yeah,
yeah, a
yeah,
head bump.
yeah, head
So
bump.
it's so again, every child is different. Every child is different. And one thing I love about your platform is called raising kids.
Yeah,
No two kids are the same.
no,
No
at
kids,
all.
no. One kid can have a head bump and be absolutely fine, and another kid could be a life-threatening issue. I
Mm-hmm.
think as parents and people that care for children, it's always important to just monitor that child. I think it's always
Okay.
important to monitor. You should always seek urgent medical attention
Mm-hmm.
if a child is vomiting, definitely. If a
Okay.
child loses consciousness, again, back
Yeah.
to that earlier topic of are they feeling sleepier? Do
Yeah.
they say that they want to sleep? They don't want to
Yeah.
wake up?
Yeah.
Um, if it seems as though the bump itself is growing,
Mm-hmm.
yeah, if it looks like it's growing,
Mm-hmm.
100%. Sometimes you can look at a bump and you can feel the texture. Is there fluid in this or is it
Yeah.
hard? You know,
Yeah.
likewise, for me, I always say that it's better to be safe than sorry.
Of
It's
course.
always good to make sure that your child is assessed.
Mm.
You know, I found that in my experience. Like you said, some children will be absolutely fine when they come back from
Mm-hmm.
school.
Mm-hmm.
Then the following day,
Mm-hmm.
the child is sleepy, the child doesn't want to do anything. I mean, in my experience, that's happened before.
Mm.
And thankfully, this was a really, I would say, conscientious mother. She knew
Mm.
that something was wrong with her child. There was actually a bleed on the brain.
Oh.
Yeah, it was yeah, yeah. So it
Oh.
wasn't, it wasn't, I wouldn't say it was in the space of 2 days or I think this was in the space of about a week. So the
Mm.
child had gone to school, bumped his head. There were no visible signs actually. But she
Mm.
said that since he came back, he just wasn't really himself, really quiet, really subdued. Child was always saying they were tired. Child
Mm-hmm.
was not eating as much. We all know that children can eat a lot,
Yeah, of course.
and again, that's what it goes back to what I was saying around assessing
Mm.
your child,
Your child,
their
yeah.
airway, their breathing, their circulation.
Mm.
As soon as she noticed that, I think day 3, she had come to hospital. We sent her back home. She'd come back again. We sent her back home. I think it was day 3 when we did a CT scan, and actually it showed that there was a bleed.
Oh.
So, but thankfully, found it on time. You know.
Mm.
So again, that's what I mean by no children are the same. So that's
Mm.
worst case scenario, and God
Yeah.
forbid that would
Yeah.
ever happen to anyone. But
Yeah.
these things do happen. But I will always say that you should always seek urgent medical attention
Okay.
in those serious scenarios. But
Mm-hmm.
actually, most head bumps, most of them. So when you hear from school, oh, it's nothing.
Mm-hmm.
Most of them are minor. Most of them. You should always
Mm.
monitor the child.
Mm.
You should always monitor. But most of them, touch wood.
Mm.
Yeah.
Yeah. Wow. Thank
Mm,
you very much, Esther. Thank you.
yeah.
Thank you. Any
Thank you.
final encouragement or words
Oh
for?
yeah. Oh wow. So I would say that from a health perspective, um well, I believe this is a global platform. So
It
but
is.
I'm talking more so just from the UK. Our doctors are busy, our nurses are busy. Somebody asked me, why is it so hard to get an appointment? Why is it so
Mm-hmm.
hard? But actually some of this area or this topic that we've talked about, you
Mm-hmm.
know, if parents and carers familiarize themselves with this,
Mm-hmm. Mm-hmm.
it's very helpful because actually
Yeah.
this is when I should go to A&E.
Yeah.
This is
Yeah.
when I should go to a doctor. Or
Yeah.
actually, this is when I should stay at home and manage this at home. So I think it's really, really important that this platform raising kids is awesome, and big shout out to you. And I see the different
Oh,
topic
thank
and
you.
different areas.
Thank
Health is
you.
wealth, not
Yeah.
just when you're 60, even when
Yeah.
you're age 6.
Of
And
course.
actually it's so important to familiarize ourselves and educate ourselves. And there's
Mm.
so much on the internet. There's so much. And people talk, but also it's so
Mhm.
important to be evidence based. So
Yeah.
any decision that you take as a parent, as a carer,
Mm.
make sure,
Mm.
is this backed by evidence? Is this backed by
Mhm.
health professionals, or is this
Mhm.
something that I've seen on a WhatsApp group somewhere?
Yeah. Yeah.
So that will be my final message. But
Oh.
yeah, and more so with summer coming up
Mhm.
happening, it's
Mhm.
so important to take care of one another. And actually,
Yeah.
especially the older children,
Of course.
have these discussions with
Of
young
course.
people, have them with your teenagers, because they may be going out with their friends and
Yeah.
something can happen. So
Mhm.
it's important
Mhm.
to have these discussions. But
Yeah.
yeah, it's
Thank
it's,
you.
it's been a pleasure to be here.
Ah,
Thank you for having
thank
me.
you so much, Esther. Thank you.
Thank you
Thank
for
you.
having me.
Thank you.
Thank you for
Thank you
having me.
so much. And thank you, everyone, for watching. Thank you again to our guests for sharing this valuable advice with us today. And I hope this conversation has helped you to be more confident and to have more practical knowledge about what to do when your child is choking or yes,
Emergency
in
situations.
emergency, yeah,
Yeah,
in any
yeah,
emergency situation.
yeah.
Thank you again. And I'll see you again in my next video. Take care for now. Please
Bye.
do not forget to like,
Like,
to share,
comment,
and subscribe.
subscribe,
Yes,
and
and
hype
share
the
with other
video.
parents.
And hype the video. Make sure.
Thank you. Thank you so much.
Bye.
Thank you, everyone. Bye-bye.
Bye.
Bye.